Hello, hi, good afternoon, everyone. Welcome to our session on chronic disease series 1. And we have staff nurse Sadda and staff nurse Christina who will share more with you for this topic. So it has been quite long since we last saw everyone because this month onward we actually have our friends from NTUC Health who have shared with who will be joining us for the health talk. So they will be, I understand that they have already gave 2 sessions for the last 2 Mondays. So I hope all of you enjoy the session with them. And so for this week and next week, it will be our SGH nurses who will be sharing their health talk with all of you. Yep, so passing over the time to you, Sada and Christina.
Thank you, Felicia. Hi, everyone. Welcome to our health talk today. I am Nurse Christina and my partner here, Saada. We are going to share our topic with you about high blood pressure. Do take note of few housekeeping during the health talk. Kindly keep muted until the Q&A session, or you can also type in your question in the Zoom chat box provided in the upper right-hand corner. Right, thank you for understanding. Let's begin. Okay, so here are the contents for today. What is blood pressure? What is high blood pressure? Causes and risk factors, signs and symptoms of hypertension, complication of hypertension. What are the treatment available for hypertension? What can I do self-care when I have hypertension? So what is blood pressure? So blood pressure refers to the force of the body blood pushing against the inner wall of the blood vessels, especially the arteries. Each time the heart contracts, it pumps blood into the arteries. Your blood pressure doesn't stay constant throughout the day. It is lowest when you are sleeping and rises when you get up and start moving about. It can also go up when you're excited, nervous, or physically active. So blood pressure, or known as BP, is described by 2 numbers. Example, 120 over 80 mmHg means systolic BP is 120 mmHg and diastolic BP is 80 mmHg. Systolic pressure refers to blood pressure in the arteries that result when your heart contracts or beats, pushing out blood. When your blood relaxes between beats, blood pressure in the artery falls. This is diastolic pressure. Diastolic pressure can increase with age as a result of stiffening of the arteries. So what is high blood pressure? When your blood pressure reading taken on different days are consistently high at a different measurement, usually it have no symptoms. In more than 90% of the cases, the causes of hypertension is unknown. The remaining 10% may due to kidney disease, narrowing of certain blood vessels, or hormonal imbalance. If untreated, it could lead to serious complications. So hypertension in Singapore, according to HPB, Heart Promotion Board, the older you are, the more likely you are to have hypertension. So the causes and risk factor, in 95% of the cases, the cause of hypertension is unknown. In 5% of the cases, hypertension may be due to causes such as kidney disease, narrowing of certain blood vessels, or hormonal imbalance. Certain risk factors increase the chance of developing hypertension. These include obesity and diabetes. So as you can see here, the risk factor, it could be overweight, which is BMI more than 23, excessive alcohol intake, smoking, sedentary lifestyle or lack of exercises, stress, salty food, family history, and also aging. So, why is my reading so high? But I'm feeling okay, I got no symptom. So hypertension is often called as the silent killer. This is because even when severe, it may not have rise to any symptom. Occasionally, you can have headache or giddiness when the hypertension is severe. However, these symptoms are not specific to hypertension. They are also present in other diseases. Sometimes hypertension is only discovered when complication sets in, example, stroke, heart attack, or kidney failure. So the complications, hypertension increases the Hypertension increases the risk of developing arteriosclerosis or the hardening or narrowing of the arteries. If untreated or inadequate treatment, hypertension can cause the following problems: coronary heart disease, heart failure, stroke, peripheral artery disease, or known as narrowing of the blood vessels of the eyes and limbs, kidney failure. The risk of suffering from complication of hypertension is increased if you are a smoker, if you're suffering from diabetes, if you have high blood pressure, high blood cholesterol, and if you are overweight, which is BMI more than 23. So screening and diagnosis. If you are diagnosed with hypertension, your doctor will most likely to do a medical history, examine you physically, check for signs of complication, example, heart failure, kidney failure, do relevant blood and urine tests, do a chest x-ray, and do a electrocardiogram, which means see your heartbeat. Okay, so to monitor your blood pressure, checking your blood pressure at home helps you to keep a closer watch on your blood pressure and manage your hypertension better. There are many types of home blood pressure monitors available. Your doctor will help you to choose one is the best for you and advise you on how to use it. So measurement blood pressure at home, you can measure your own blood pressure at home with a digital blood pressure device that can be purchased at most pharmacies. Read the instruction carefully. You may wish to calibrate your reading with your family doctor. The right time to take your measurement of your blood pressure when you are at rest. Some tips that will help ensure the accuracy of your blood pressure reading include sitting on a comfortable position, placing your left arm raised at the level of your heart on a table or desk, and sit still. Wrap the cuff of the monitor smoothly, snugly around the upper part of your bare arm. Okay. So as you can see, your doctor will help to work out your personal target for your blood glucose, blood pressure, and blood cholesterol. So as you can see, the normal blood pressure, we targeted at less than 130. That is for your systolic blood pressure. And for your diastolic blood pressure, we target at less than 80. So understanding your blood pressure reading. So the one highlighted in yellow is systolic pressure, which means your heart pumping. And your diastolic pressure on red means your heart filling. So the light blue one is your heart rate, number of times your heartbeat in 1 minute. For the treatment, there are many types of drugs available. Your doctor will decide which drug is most suitable for you. More than one drug can be prescribed to your blood pressure at an acceptable level. Single drug which combine with medication from 2 different groups are also available. If you are on antihypertensive drug, note of the following. Treatment is lifelong, so you have to continue with the medication and also discuss with your doctor the antihypertensive medication. Do not change or do not stop the dose of your medication without consulting your doctor. For effective blood pressure control, make sure you see your doctor regularly to monitor your blood pressure. You can also monitor your blood pressure more frequently at home with your electronic BP monitor. So remember, long-term effective control of blood pressure is crucial in reducing risk of serious complication of hypertension. Okay, so know the names of the doses and the names of your medication that you are taking. Take it regularly as directed by your doctor. Never stop taking medicine, even if you are feeling better. It helps to lower your blood pressure and keep it under control, which also helps to prevent other complications like stroke, heart attack, and kidney failure. You may need to take the medicines for life. Ask the doctor or pharmacist advice before crushing or splitting the tablets. Some should only be swallowed whole. Stop taking alcohol. Check with your doctor or pharmacist if there is any food or other medicines that you need to avoid while taking this medication. Take the medicine before or after food as indicated in the label according to the doctor or pharmacist's instruction. Never take someone else's prescribed medicine or share yours with someone else. For women of childbearing age, inform the doctor if you are pregnant, intend to be pregnant, or breastfeeding. Like all medicines, some people may be allergic to hypertension medicine. If you develop any rashes, difficulty in breathing, or swallowing after taking the medicine, stop medicating and seek medical attention immediately. So next, I will pass the time to Nurse Saada to explain us more about self-care.
Okay, thank you, Christina. A very good afternoon to everyone. My name is Nur Sada. Let's begin with a short true or false game. Okay, I will give a statement, then you can try to guess whether the statement is it true or false. So for those who would like to share your guess, feel free to unmute yourself lah. So the statement is, once my blood pressure is within normal range, I can stop taking my medication. True or false, this statement? Anyone want to make a guess?
False.
Okay, great. I can see answer coming. Thank you for the active participation. I can also see from the chat box. Okay, anyone else? Okay. Yes, the answer is false. Okay, blood pressure treatment is usually lifelong. Never stop or change the dose of your medication without consulting your doctor. Okay, next. Okay, what can I do to self-care when I have hypertension? Well, the first tip is to control your weight. Maintain a healthy weight. So if you are overweight with a body mass index of over 23 kilogram per meter square, make the commitment to lose weight by eating less and exercising more. Both efforts are important to achieve a healthy weight lah. Okay, next. Okay, next tip is healthy diet. Eat a well-balanced diet which includes whole grain food, vegetables, and fruit. The best is to reduce the amount of salt and bad fats in our diet. We will talk about salts in the following slide. I also would like to say that fiber can speed up the removal of your bad cholesterol or fat from the blood lah. So we should limit the amount of butter, processed and deep fried foods and other fatty items in our diet. Saturated fats, examples like lard, ghee, butter, coconut and palm oil. Try to replace with unsaturated fats instead, such as canola, olive, sunflower, corn and peanut oil. Other foods which are high in unsaturated fats, which is good, include oils from seed, nuts, and fatty fish such as our salmon and mackerel. So always remember, limit your cholesterol intake. Major sources include internal organs such as liver, kidney, intestine, and heart. Seafood also, such as squid, shellfish, prawns, and crabs. Okay, next. Okay, let us now take a look on salts in food. So salt, right, contains 40% sodium. So sodium is a mineral which is essential for the normal functioning of the body. But however, if you take too much sodium in your system, it can cause your body to retain more water. This puts an extra burden on your heart and blood vessels and therefore raise your blood pressure. So that's why it's important to look into the sodium intake of our food lah. So do you know that the average Singaporean adult consumes about 9 grams of salts per day, which is more than the recommended daily intake of 5 grams. So the recommended daily intake is 5 grams. 5 grams is equivalent to 1 teaspoon of salt. And if you have diabetes and high blood pressure, your doctor may even recommend taking lesser. So let us take a look at the contents of sodium found in these common sources and seasoning. So for example, let's take a look at 1 teaspoon of dark chili sauce. So it already contains 60 milligram of sodium. And then let's take a look at 1 teaspoon of dark oyster sauce. It already contains 190 milligram of sodium. Then another common one, 1 teaspoon of dark soya sauce. It already contains 200 oh, it's not here. Okay, can. And also the most common one, 1 stock cube. 1 stock cube contains 4,600 milligram of sodium. So let us be aware of the sodium content found in our food. Okay, next. Before the slide, got another slide, right? Oh, okay. Okay. Let's play the true or false game again. So this statement, right, you can try to guess whether is it true or false. So this statement, I always eat out, cannot be healthy. What do you think? True or false?
False.
False.
Eat out no good.
Okay. Eat out no good. Okay.
Not every day lah. Not always. Once a
That's-
while, okay.
Okay, I can see a mix of true or false lah, but mostly false. Well, the answer is false. Okay. The truth is you can do something about it. So even though you eat outside, right, you can do something about it to be healthy lah. So when eating out, ask for your food to be prepared with less salt and sauces where possible. Ask for the sauces to be served on the side lah. So taste food first. Try not to add more salt or sauces to food at the table. And then avoid drinking up the soup stocks and sauces as they contain a lot of sodium as we shared earlier. And then another tip is that when you eat out, do a visual check and pick cooked food items that do not look greasy. So avoid oily, deep fried food and dishes with gravy that have oil floating on the surface. Okay, next. Okay, let's make a guess at how much salt these plates of food contain. How much salt these plates of food contain? Actually the answer is there. So one plate of chicken rice, it already contain 3 grams of salt. So do you remember what is the daily recommended requirement of salt intake per day that was mentioned earlier? Anyone?
1 teaspoon of salt.
5 grams.
Okay, good. Yeah, both answer is correct. So the daily recommended is 1 teaspoon of salt, which is equivalent to 5 grams. Okay, so next question. So if a person eats 1 plate of chicken rice for lunch, and then another 1 plate of char kway teow for dinner, what is the total amount of salt consumed per day?
7.
7
Yeah.
grams.
Yeah, 7. So how much has it exceeded the recommended 5 milligram of salt for the day?
2 grams.
2 grams. Yeah, it's already exceeded. So yes, and this is not counting for the chicken soup that is served together with the chicken rice. And also, we also have not included the breakfast meal. Okay, great. Okay, other tips is to choose healthier choice logos. If you can choose brown rice over white rice will be good. Drink plain water or Chinese tea lah, instead of bowl of chicken soup. For laksa, don't drink the gravy too much. Then the chili sauce is also oily lah, can limit that too. And then last tip is for char kway teow. Yeah, nice food, right? I can see that's funny. Yeah, char kway teow. Reduce the amount consumed. So for example, you can ask them lah for 1/4 plate instead. Then ask for less oil, less sweet dark sauce, or less chili and no egg.
Don't eat lah.
Okay, don't eat. You need to eat Okay, next slide. Okay, how about this food? They look delicious.
Total 7 kg. Chicken
What do
bread.
you?
One.
Yeah, so it's 1 bowl of mee soto, chicken breaded, and also burger lah. What do you think we can do to reduce the salt and oil content? To make them healthier, at the same time we can satisfy our craving. So let's start with mee soto lah. So for mee soto, why not eat it but don't take too much of the gravy? So this is one of the things that we can do. Then for chicken breaded, right?
Remove
not
the
we-
bread. Remove
Remove?
the flour coating.
Yes, correct. That's a good tip. Yeah, remove the skin lah, and also try to reduce the quantity if you can also. And then for the burger, a bit difficult to
Take out Share with somebody.
Oh yeah, that's a good idea also. And another one is also you can try to substitute with whole meal bun lah, if option is given lah. You can also try to ask for no additional cheese. Okay, next. Okay, let us take a look at these 2 pictures. Both are vegetables. So which one do you think is a healthier choice?
Fresh.
Vegetable. Answer given.
Fresh vegetables. Yeah, correct. So, why?
No, it's not preserved. Some they are preserved in salt.
Yes, correct. So you mentioning preservatives and salt lah. So the reason why fresh vegetables are better is because they contain fresh vegetables are better because they contain less salt, oil, and preservative. Okay, next. Okay, how about this? Which one is the healthier choice?
Answer already given.
Yeah, answer also already given lah. Yeah, so the answer is fresh produce because they contain same reason also because they contain less salt, oil, and preservative. So always don't take the preserved meat lah. If you can choose, you choose the fresh produce. Okay, next. Okay, this one also answer given lah. So what can you add in your cooking instead of salt? So which is the healthier choice? Yeah, of course is spices. Yes, of course it's the first picture. So some of the alternative to salt to flavor our food includes we can try to put lime, ginger, chili, garlic, pepper, herbs, and just now someone mentioned spices. Yeah. Okay, next. Okay, I would also like to share, healthy plate. Yeah, I can hear people mentioning healthy plate. So this is my healthy plate. So this is the best guide to eat a variety from different food groups in moderation, and you can have your balanced diet. So a balanced diet will provide our body with enough nutrients for our needs lah. So half of the plate should consist of fruits and vegetables. 1/4 of the plate would be your carbohydrates, which can be your brown rice, wholemeal bread, or wholemeal pasta. And then another 1/4 of the plate should consist of meat or vegetable protein also, such as tofu. And then always remember that in addition, you need to remember to drink plain water instead of sugary or canned drinks. Choose healthier oils and be active. Okay, next. Okay, next is stay active and exercise. Okay, then how much then we need to exercise? Anyone want to make a guess?
150 hours per week.
200 minutes per week. 300 minutes.
Oh, nearly lah.
30 minutes a day.
So just now someone mentioned 150 minutes, 150 hours per week, right? So actually the number is correct, but it's minutes lah. Okay. So Promotion Board recommends to exercise at least. Okay, hold on lah. Okay, can you hear me? So Health Promotion Board, right, recommends to exercise at least 150 minutes per week, but each time at least 10 minutes. Okay. Okay, now we will be sharing with you. Okay, the new recommended one. Okay, that one is at least lah. So if you do more, then it will be better. So the minimum is 150 minutes. Thank you for sharing that. We will be sharing with you a good example of a strength and balance exercise by Health Promotion Board. We actually cut the video short lah for this presentation. For those who are interested, you can stand up and do this simple exercise because this is a good example of a strength and balance exercise. Okay.
Warm-up exercise. Stationary march with arm swing. Stand upright. Start slow marching on the spot at your own pace. Then lift your knees slightly higher. Swing your arms as you march. Each set is 1 minute, and you need to do 3 sets. If you are frail, you can also do the exercise sitting down. Sit straight and tall. Start marching, focusing on lifting your thighs off the seat. Okay, let's start. Stand upright. Start slow marching on the spot at your own pace. Then lift your knee slightly higher. Swing your arms as you march. "30 seconds. "45 seconds. "1 minute. Okay, let's do the second set. Stand straight again. "15 seconds. Always remember to warm up. It helps your body prepare for exercise by increasing your body temperature. It also increases blood circulation throughout your muscles, tendons, and ligaments. The stationary march with arm swing warms up the lower limb muscles and muscles around the shoulder joints. "45 seconds. Okay, 1 minute is up.
Okay, thank you. Okay, so that is an example of a good strength and balance exercise. We will continue with the presentation for the self-care for hypertension. So next is limit alcohol intake and don't smoke. So if you drink alcohol, limit the alcohol intake lah. So but then right, for those who do not drink, do not start, alcohol not only increases your blood pressure, it also is high in calories, which contribute to weight gain. So when we say limit alcohol intake, right, how much to limit? So it is recommended to limit alcohol intake to no more than 2 standard drinks per day. So how much is 2 standard drinks per day? So 1 standard drink is equivalent to 10 grams of alcohol. So which is equivalent to about 2/3 of small can of beer, or 1 glass of wine, or 1 nip of spirit. So and then if you smoke, quit smoking, because chemical in cigarette increases risk of high BP and can cause hardening of your artery. If you can't quit, then you reduce your smoking. Okay. Next tip is to note your blood pressure trend. So allow doctor to adjust medication dosage to achieve therapeutic drug effect lah. So try to take blood pressure at the same time every day, as different timings may give different readings too. Take blood pressure at an upright position. Position blood pressure machine at chest level. Always remember to take a 15-minute break after strenuous exercise before measurement. And then just to reinforce, avoid measuring after a heavy meal. After you drink coffee, after you cigarette smoking, whenever you feel anxious or upset or nervous, or when in a hurry, you avoid taking your blood pressure at that times lah. Just remember to have a 15 minutes break first, and then remember to show your record to the doctor during each visit, so that the doctor can adjust and review your blood pressure to achieve the therapeutic drug effect. Okay, next. Okay, another true or false question again. So the statement is, can you tell whether someone has hypertension? True or false? I can tell whether someone has hypertension. True or false?
False.
False. Okay, I can see answers coming from the chat box.
False, false.
False. Okay, majority, I think everyone say false. I never hear any true. Okay, yes, correct. The answer is false. You can't tell. Because majority of people do not feel unwell. So usually detected during the routine checkup. That's why like my colleague mentioned earlier, hypertension is known as the silent killer. Okay, next. So there are no obvious symptoms for people with hypertension. Okay, we have come to the end of presentation. We would like to thank everyone for their participation and time. We would also like to introduce you to our program. We are from community nursing. We are situated at various community nurse posts at Teluk Blangah, Chinatown, Katong, Bukit Merah, and Tiong Bahru. So if you stay near the following areas and are keen to find out more about us, you can drop us an email or you can call us at this number that we put here, 65761652. Okay, thank you everyone. Oh, if you have any questions pertaining to the topic we have presented earlier, please feel free to ask us. We will try our best to answer them for you. Thank you.
Okay, thank you, Sada and Christina. I think we got a question on the chat box. So let me see. We have one question from Jessie. She's asking, when is the right time to take medication? Is it morning, afternoon, or bedtime? Do we have a specific time to actually take in medication?
Hi, thank you, Jessie, for the question. So it's pertaining about medication timing. So always go back to the prescription. So the doctor might order because usually it's prescribed lah. So sometimes you have only morning medication. So that's when you only take morning. So if let's say you have three times, right, morning, afternoon, and night, right, then you have to take as prescribed lah, because it varies. Because sometimes the doctor give you prescribe you with more dosage, right? It is in like with more timing because it's for your own blood pressure reading lah, for them to titrate lah. Yeah, so always go back to the prescription lah and follow. Thank you.
Hi, good afternoon. Can you please explain what is the two different type of BP? The first one is the systolic. The second one is the diastolic. Hello, can you hear me?
Yes, we can hear you. Okay. Please can I explain?
So basically, systolic, the one quoted in the yellow, is the heart pumping. Then the diastolic, whereby they're reading the second reading when your heart is filling up. Yeah, so this is the systolic and diastolic.
What do you mean by heart filling?
The tongue. I know my question.
Okay, let me try to explain now. Hold on, give me a moment. So blood pressure, right, it always been described by two numbers. So the first one is, we call it systolic pressure. So how much pressure in the blood is exerting against the artery wall when your heart contracts. Okay, so that's the first reading. Okay, then for the second reading is when so one is contract, right? The other one is filling.
What do you mean by contract? What do you mean by the heart is contracting?
So our heart, right, when they pump, right, they contract and then they expand to so that pressure. So one is high, one is low lah, because one is contract, so the pressure is the highest point. Then when the other one is when the pressure is at the lowest point.
Oh, yeah. Okay. So it's always in opposite direction now. Pump once expand, then you read your upper range. Then once is contract, you read your lower range. Is it?
Yes, correct. Yeah. So
But I thought you said for you said the normal range, the upper one is 120/80, the other one is mustn't above 80. But then as a person grows older, the upper, the systolic one is always higher than what they recommend, 140. You know. If let's say those people who are in their 70s, they can easily range to 160 or 170 and above. You know, is it true?
Yeah. So that's why the doctor will help you work out your personal target. So this one is just from it's just a guide for I would say like normal adults that don't have blood pressure, don't have hypertension, right? So this is the normal targets lah. But if let's say you are older, then you have hypertension, then the doctor might change your personal targets lah. So there are some that their personal targets is like less than 140. Okay.
Oh, you mean a normal person don't have BP, don't have high blood pressure? If let's say it's
So
in the
this is
80s, their high is still 140. If let's say they don't have the sickness, BP sickness, high blood pressure, but then again, if they're in the 80s, the high is still, the range is still 140. Does not mean you go according with age, even though you have high blood pressure or low blood pressure.
Yeah, that's why you need to work out with the doctor to work out personal targets. So there's personal targets also. Yeah. So it's individualized also.
Okay.
Okay.
Thank you all for the question. I think we have 2 questions from the chat itself. Another one is from Jessie. I know my pressure is higher. So she was asking if she's able to take the BP reading after exercising.
Not BP, the medication.
Okay, maybe you go right to on your mic, Jessie, so you maybe can share more.
Oh, I thought I on it already. I'm no longer mute.
Okay, do you want me to share more on the questions regarding
that? It's more of, I understand that the doctors will always advise you to take it in the morning, so that we will not forget after that. But is there an ideal time? Like if I find that my pressure is okay upon waking up, I would like to take it like in the midday. Is it okay? I take it at the same time, midday.
Hello, hi, Jessie, right? Yeah. Yeah, usually the doctor will advise to monitor your blood pressure lah. Usually they will just start off with morning, but actually it's good to actually monitor morning, afternoon, and also night time lah.
Oh, I'm not referring to monitoring my measurement. I'm just referring to taking the medication.
The medication?
Yes. That means to say that usually doctors will
prescription?
advise like you to take in the morning. But when I wake up in the morning, my blood pressure is quite normal, very nice range because I'm at rest. Can I take it like in the mid-afternoon when the weather is so hot? I feel somehow stressed and my blood pressures go up. So can I take it the same time at mid-afternoon? So instead of taking in the morning, I take it in the middle of the day.
Okay, this one you need to get back to your doctor. Then yeah, you share with them about like the it's about the weather. Is it too hot? Is it?
Yeah, I mean it's like changing the timing of taking the medication. Because I know of people who take it at bedtime as well. But then there's actually a meaning to it. If you were to take at bedtime, it helps for those older people because just in case that at bed when they're sleeping, it will help them in normalizing their blood pressure.
Okay, I think the best is you go back to your doctor then explain, because usually the doctor will listen to you and they will change your prescription lah. But of course they will also, it's good to let the doctor know so that they can adjust your medication also then to make sure that you get the therapeutic drug effect.
Yeah, I know,
Yeah.
I understand it because I'm taking the lowest dose, and although I check regularly and also when at the clinic, my reading is usually 120/80, but I'm still it's under medication, so it could be the medications that helps me to have a normal reading.
Yes.
Okay.
Okay, thank you for sharing.
Is it good to take medicine on an empty stomach, even though the doctor mentioned in the morning? They didn't say what specific time. Can we take it on an empty stomach or must be after a meal?
Check medication.
Usually, actually, some of the hypertensive medicine is not really like you need to take before or after lah. So, as yeah, but a lot of people like they feel better.
It's already taken. It's stated there may be taken with or without food.
Without, yeah.
With
So
or
it's
without.
like, yeah, with or without. So that's when you look at your prescription label. So if let's say there's that statement, right? So you know that you can take either or. Yeah. So if let's say other medication that you check the label, they instruct you like to take before, and then you take before. Yeah. So it depends on the medication because there's a lot of medication.
Yes.
Yeah.
But I'm wondering, how come when one upon taking the medication, why is it that it's impossible or unable to go back to, you know, when it's normal and then you can go without? That means it's really true that by taking the blood pressure medication, you have to take for life. Is it very true?
Oh.
So that's why we say that usually the medication is lifelong lah. Yeah.
That's
It's
the
very
reason that a
rare
lot
that-
of people don't want to go to the clinic and have the test.
Oh, that's the reason why.
That's the reason why those who are not
Mm.
aware that they have blood pressure problem didn't go for the test, so they are unaware, and as is already mentioned, there's no symptom, so that could be the cause of it.
Yeah.
The reason that people avoid going to have a test is they don't want to take the medication for life.
Okay, let's be aware also lah the complications. So yes, true, hypertension is a silent killer. There are not much symptoms, but then usually, right, when you know that you have this hypertension is when complications already happen, such as stroke, heart attack. So we need to tell ourselves like, will we want to go for earlier screening or we want to wait for the complication to happen? Then we know we have hypertension. So I think we need to think again, like screening is actually important lah. Yeah.
Yeah, thank you.
Okay, thank you.
Okay, may I ask? I heard that like some like calcium pill or what cannot eat and mix with other medicine, or can we all lump together to eat all the medication in case we forget? No, like certain old people they have a lot of medication to take. One whole go we lump all the medicine together. Is it okay?
I think it's not advisable.
But then one tend to forget, as you grow old.
That's the reason. That's the reason. Because of forgetfulness, doctor would want you to take in the morning. I mean, if you have someone who can help her, then you just have to at least arrange like half an hour or 1 hour later.
Wow,
Imagine you take all the medication, high blood pressure, cholesterol, diabetics, you know, everything together. Your body will be taking the load of the medication at the same time.
Oh, that means it affect your kidney, you mean?
I mean, there is no, I think there's no research to say that it will affect the kidney, but if the person is able to control, that means unless the person there's nobody there to help her, she may be alone at home, then ideally she can't do anything, she has to take it together. But if there's a family members who can help and then can just arrange for the medication to take in.
That means every medicine also have to take half an hour. Wow, that means cholesterol half an hour later.
It's not the half an hour. The doctor usually will tell you.
Okay, I think for calcium. Oh, okay.
Yeah, just to answer that question, whether you can eat medication together. Some of the medication they can eat together. When you have your medication, right, when doctor prescribe all your medication, right, high blood pressure, cholesterol, calcium, anything, when you go to the pharmacist will actually advise you whether they can eat together or not. So it's best to ask them on the spot when you get all your, especially all those new medication, they will look through all your old ones also. Then you can ask them, say, can I eat together? They will advise you, say, yes, all these things can eat together. Is it best to eat before food or after food? They will tell you which one is best to eat before or after. Then you can have pill boxes. Then you put them in the pill boxes Monday to Friday, those morning medicine before or after food. Yes, this Miss Yo, yeah, she showed the pill box. Easier for you to remember lah. I mean, because all of us memory also like not very good, right, as we go older. So these are some of the ways we can actually help ourselves to remember. So always when you go to doctor, when they give you new medication, the pharmacist is the best person to ask.
No, I know they always advise you can take all together, but just now that lady Jessie says that the load, yeah, she has a point there, you know.
Okay, she mentioned about calcium, right? Calcium, right? Okay,
calcium
so
all your vitamin or whatever, all your medication all lumped together, one go you swallow, you know. So you won't forget.
Imagine like 10 pills.
So I know that you guys have a lot of medication, but just to let you know, okay, because someone actually mentioning about calcium lah. So calcium, right, it can decrease absorption of other drugs. That's the reason.
Yeah, that's why.
So, but then we also don't know what other drugs that you guys are having. So that's why the best is to ask the pharmacy. So example of the drugs that they can interact is your antibiotic, and also not all antibiotic, for certain antibiotic. And then yeah, so that's why it's very hard for us to tell you like what is what, because we don't know your medication. So again, the best advice would be from the pharmacist itself.
Okay. My question is the coffee, if you take calcium, can you take immediately after coffee or before coffee, or you have to wait for a lapse of 2 hours after that? Calcium with coffee.
So what does the pharmacist tell you? As in from the label?
No, some advise that not, some say can. That's why I'm always lost, you know, whether calcium can drink. Let's say I eat my breakfast with my coffee. Immediately after that, I pop my calcium pill. But they say it's so close range, you know, don't have an interval of 1 hour or 2 hours. Is it possible to eat like that?
Okay, the best is still go back to the pharmacy. But anyway, right, coffee is acidic, calcium is alkaline, so not good to be mixed lah.
Oh, coffee is acidic.
It can be.
Coffee is acidic.
Oh, calcium is alkaline. Oh, I didn't know that. Sorry, my last question. What is peripheral artery disease?
Is it arteriosclerosis?
No, they put you say hypertension can cause peripheral artery disease. What is that? The fourth one, the fourth. Coronary heart disease, heart failure, stroke, and the fourth one. What is peripheral artery disease?
Hello.
Yeah,
my name is Jill. Yeah, one of the nurses. So peripheral artery disease, right, is because when your hypertension, your blood pressure is very high, right? So it will damage the vessels in your peripheries. Peripheries, that means like your legs, your feet, or even can be your hands if it's very bad. So when the artery is damaged, then it will cause like other complications that can appear on the outside of your limbs. So like on your leg, you can develop like ulcers, and then the blood flow will not be good. Then you end up getting like gangrene, which is like the blood flow doesn't go to your toes or your fingers. Then you I mean, worst case scenario can result in amputation and things like that. Yeah, so that's peripheral
diabetic, not hypertension, no?
That's the thing. So hypertension can also cause this, and hypertension conversely can also cause diabetes, and diabetes also can cause hypertension. Yeah.
I thought you said amputation is normally caused by diabetic, but no, I never heard of hypertension.
Correct.
amputation.
This is in very bad situation. So when the hypertension is very bad, it will cause the artery to become very damaged, and then can lead to when all the your toes or your fingers, your digits your limbs become lack of oxygen, and then you will develop all these ulcers and tissue damage.
Okay.
I hope this answers your question.
Sure. Another one, peripheral is the limbs, is the outer
correct. So all the outside lah. So what is central is like our head, the spine area, and then the peripherals are like our hands, the toes, the feet. But mostly occurs in the feet because that's the furthest away from our heart. Yeah.
Okay, sure. Thank you.
Can I just ask one question? Which is a more accurate one, the right arm or left arm, the one that you read?
I think usually the blood pressure on our left arm is a bit higher because it's closer to our heart and closer to the aorta where the blood pumps the blood out of our heart. Yeah, but
so they take the blood pressure, they always check the left arm or right arm.
Technically, there's not much difference, and there should not be a big difference. If there's a big difference, then that means there is some blockage in your artery or one of your blood vessels, which that would be quite worrying. We'll need some medical intervention.
For me, my blood pressure is right arm 118/67. Left arm is 123/69. So it's normal, right?
Yeah, so that's very good. So actually, that kind of difference is a negligible difference. So you don't have to worry too much about that. But if the difference is maybe like, maybe on the right arm is like 102, and then on the left arm is like 18 something, 186, 185 like that, then that's something to be concerned about. Otherwise, it's actually quite okay. If the difference is like 11 something and 12 something, that difference is actually quite all right. That's still acceptable.
Sorry, I missed that part. You said which part is nearer to the heart, the right or the left?
So the left side, because our heart on the left of our body, and we take the pledge, right? Put the hand over the heart on the left side. Yeah.
So the left side normally should be higher, like because of the heartbeat.
Is not much difference. It shouldn't be much
normally
of a
should
difference.
be higher than the right lah.
Not that it should be, but it can be.
Can be, okay. Normally okay, can, all right.
Can I also maybe talk about the medication that will harm your liver and your kidney thing? So normally when doctor prescribe medication for your disease, when it's given at a therapeutic dose and your liver and your kidneys are working functionally well, it should not be toxic too much on your liver and kidney, because they're supposed to treat your disease. Then if let's say as you grow older, your liver and kidneys decline, your function becomes reduced, right? The doctor will actually titrate according to your body function, so that the drug when you take, right, it won't be too damaging to your liver and your kidney also. So don't worry, you can always talk to your doctor about your concerns. So then they will actually explain to you how the drug works and like how to reduce your fears and your concerns. If let's say you think that this medication actually harms your liver, your kidney. Like for example, Panadol, right? 1 or 2 Panadol to cure your headache is okay. Your liver and kidney will not be damaged. But if you take too much, if you take 10 Panadol at one go, then of course your liver and your kidney might be damaged a bit lah. Yeah, so just listen to your doctor, and then you can also discuss these issues with them lah.
But you said take 10 Panadol at one go is one-off thing, is it will still damage your liver and the kidney.
Yeah, it will still damage a bit, but gradually, if you take every day 10 Panadol, then it will be more damage.
But if damage is only permanent damage, or if let's say somebody will want to think of ending their life, they take 10 at one go, then after that they realize they are wrong. So will that one day at 10 tablets, will it damage the liver and kidney? Only the one time only,
One time, that one you have to go for test to see whether your liver function still functioning properly. Only the test will tell you whether your liver is still doing well or not.
Oh, okay. It's the first one damage is the liver, not the kidney. I thought it's the kidney. It's always
liver
the liver
first, then kidney.
Oh,
Because your liver will take in all your medicine.
Okay, okay. Liver, get liver and kidney. Okay.
Okay, thank you everyone. Due to constraint of time, we are sorry that we can't take any more questions. But if let's say you have questions, right, you can drop us an email or call us lah. And lastly, I would like to thank everyone here for your time and attention today. Thank you so much for your attention. Please just don't forget next week we will have the same topic but in Mandarin.
Oh, okay.
Okay.
Okay, thank you.
Bye everyone.
Thank you very much.
Right.